Okay, guys, I cut off the last video right at the end. I got a notice that Marfugal News was coming on, and I went to try to get rid of that notice, and I closed the screen with this story. So I didn't finish the story. So for all my fur baby lovers out there, I'm going to read it now and post it up on YouTube for you. Coronavirus quarantine recommended for pets of Hong Kongers with COVID-19 as Pomeranian test positive a second time. But they haven't done a blood test yet. But city's veterinarian surgeons say no evidence yet coronavirus could infect domesticated animals, as there is a high possibility of environmental contamination. Oral and nasal samples taken from the pet dog tested weak positive on Friday, the same results as obtained the previous day. There the baby is right there. Oh my goodness. Oh, and her mommy's sick. Her mommy's sick with the coronavirus. Oh, I hope this doesn't happen to anybody. Hong Kong's Department of Health. Hong Kong's Department of Health is strongly recommending that dogs, cats, and other mammals of confirmed COVID-19 patients undergo a 14-day quarantine after a pet Pomeranian of one patient again registered a weak positive for the virus that causes the disease in a second test. Previously, family members were allowed to care for the pets of the infected if they did not live with the patients and were not subject to quarantine themselves. But from now on, we will ask owners to send their pets to the Agriculture, Fisheries, and Conservation Department for quarantine just to make sure they are not infected, said Dr. Chong Shuk Kwan, head of the Communicable Disease Branch for the Center for Health Protection. The Department of Health later clarified that this was not a mandatory requirement, but was unable to say what would be done if a patient refused to surrender their pet, as they had not confronted such a situation yet. The move came as the department revealed late on Friday that oral and nasal samples taken from the pet dog tested weak positive earlier in the day, the same result as obtained in a test on Thursday. The department said it would continue to do tests on the dog, which would not be returned until the results were negative. Chong said a cat belonging to a Hong Kong's 18th confirmed patient, a 25-year-old man, had previously been sent to a department for testing. Its results were negative, and the cat, an exotic shorthair, was sent back to its owner, who was discharged from the hospital on February 12th. A Shiba Inu dog belonging to a 68-year-old woman with the virus, meanwhile, tested negative and was still being quarantined. The woman, the city's 77th case, was one of those who tested positive after visiting the Buddhist temple in North Point. And they do touch a lot of the temple. They touch the Buddhas. And they light the candles. And so they're handling a lot of things that other people are handling. And unless they're taking the precautions, they could then touch their face and become infected. Kwong said health authorities would review the entire list of 94 patients to see if any had pets that would need to undergo testing. On the Pomeranian, the department said in a statement in the small hours of Friday that the dog, despite the initial test result, had not shown any symptoms, nor was there any evidence to suggest pets could either contract the coronavirus or be a source of infection. How many pets are abandoned in Hong Kong? I don't know. It seems to be a problem worldwide. At a morning press conference, Secretary for Food and Health Sonia Suchi confirmed that the dog would undergo a 14-day quarantine at a department animal keeping facility near Hong Kong, Shuang Macau Bridge. The department had conducted the second test to confirm if the dog was really infected with the coronavirus, or if the result could be attributed to environmental contamination of its mouth and nose. According to Chang, the dog had had relatively little contact with the outside world. As far as we know, the dog that tested weak positive is quite old and rarely goes out. Its close contacts are only the people that it lives with, who have both already been sent to quarantine, Chang said. Earlier in the day, Hong Kong veterinary surgeons called for a calm after the weak positive case was announced. Dr. Michael Bradley from Stanley Veterinarian Center said he thought it was very unlikely that pets such as dogs and cats could be infected with the coronavirus, as very few viruses can jump between species. That makes me wonder. That really makes me wonder, since they're saying that the virus came from the wet market. And obviously the wet market isn't selling human beings, it's selling animals. So they're saying that it jumped from an animal to a human. But the earlier information that was put out was that it was a Canadian lab that 2 Chinese scientists, researchers, stole the virus and took it back to Wuhan. So, I think that it's the latter. I think it's the Canadian lab, and they just don't want to admit it. And Canada doesn't want to accuse because they had that. Nobody wants to take credit. There is no need to panic. There is no evidence yet that the virus can infect dogs, cats, or other domestic animals, he said. It's possible that the dog had the virus due to environmental contamination. A dog can be an object that carries the virus the same way as anything else, like a tissue. I hope they gave that baby a bath. He suggested that owners observe basic hygiene after touching pets, especially hand washing, and avoid busy areas when walking their dogs. The dog that tested weak positive is believed to belong to a jockey club member infected with COVID-19, whose domestic helper is also infected. The pair are among the 94 confirmed cases in Hong Kong. The dog tested weak positive from the nasal and mouth swab, not from a blood test. It's quite possible it is from the dog contacting the owner or being in the same environment with the owner. Dr. David Gething, our Creature Comfort, said. That's encouraging. Oops. Okay. Professor David Huxiong Chiong, a respiratory medicine expert from Chinese University, also said that despite the pet's weak positive result, it did not mean it had been infected. It was possible that droplets from the infected pet owner had contaminated the environment or the dog, Hu said on a Friday morning radio program. He added that no evidence thus far shows that dogs can be infected with severe acute respiratory syndrome, which is SARS, or the Middle East Respiratory Syndrome, MERS, or COVID-19. A spokesman from the Happy Valley Veterinarian Clinic and Hospital said the patient visited the clinic on her own without her dog on February 22nd to pick up medication. She was wearing a mask and stayed for about 3 minutes. The clinic was notified about her test result on February 26, a day after she was diagnosed. They immediately sanitized the interior and sent home 3 receptionists who had come into contact with her for quarantine. The 3 receptionists did not qualify for the government's isolation scheme as their contact with the patient was brief. It would be unlikely other visitors and pets would be affected due to the patient's short stay and the absence of her dog, the spokesman said. A spokesman from Hong Kong Jockey Club, meanwhile, said the infected member had not visited her horse's stable within 14 days before she was confirmed to have the infection, nor did she attend her horse's most recent race on February 5th. According to the professional expertise of the club's veterinary surgeons, there is no evidence that COVID-19 causes diseases in horses or replicates in horses, he said. Nor is there any evidence to suggest that there is transmission from horses to humans. That Jockeys Club take echoed a February 14th joint statement by the Society for the Prevention of Cruelty to Animals in Hong Kong and the Hong Kong Veterinary Association, HKVA, said they had yet to find evidence that dogs or cats could be infected by the coronavirus. Oops. Nope. Oh, what did I do? Back. I'm learning. Please take me back right where I was in this story. Oh, come on. Okay. All right, now I just have to go back down here and find where I was. I'm so sorry, guys. I am not good at this. And obviously, we have to finish this story. Dr. Florence Chan, Secretary of HKVA's Executive Committee, said although what happened to the dog might appear to be a new development, it would be wrong to jump to conclusions. According to what we have on hand, the dog actually did not display any symptoms, she said. She advised pet owners to wash their hands after coming into contact with their pets and avoid taking their animals to dirty places. They should also wash their pets' paws with soap and water after taking them outside, she added. For those who find that insufficient, she recommended that owners put shoes on their pets' paws that could be removed and sanitized separately. Suppose you have a Great Dane. That will be quite a task. Professional veterinary surgeons will actively monitor and take test samples from the dog and release it when the results come back negative for the coronavirus. I hope that's a blood sample so they can show once and for all whether or not the little pup has the coronavirus. The AFCD does not, at this point in time, have sufficient evidence showing pets will contract or spread COVID-19, the health minister said. But she warned pet owners to observe good personal hygiene practices and maintain appropriate social distancing to prevent the spread of the virus. In a statement, the AFCD said that infected patients were strongly advised to put their mammalian pets under quarantine to ensure public and animal health. Although there were some suggesting pets be brought to private clinics, I think it's better to contact the government. Private clinics probably aren't equipped to diagnose the virus, Dr. David Gething, the veterinarian surgeon, said. According to the Department of Health, quarantine requirements. If pet owners are confirmed with COVID-19 infections, their pets are to be delivered to AFCD's animal keeping facility under the supervision of the veterinarian office for 2 weeks for quarantine, veterinarian monitoring, and virus test. Although there are some suggesting pets be brought to private clinics, I think it's better to contact the government because they are handling quarantine, and private clinics probably aren't equipped to diagnose the virus, Geffing said. The World Health Organization said there was no evidence that companion animals or pets such as dogs or cats could be infected with the novel coronavirus. However, it is always a good idea to wash your hands with soap and water after contact with pets. And the guideline for washing your hands is warm water with soap and to rub your hands for 20 seconds before rinsing them. That's how you kill any kind of virus or germ that you may have picked up on your hands, and especially the ends of your fingers, your fingertips. It's a kind of neglected area. So this protects you against various common bacteria such as E. coli and salmonella that can pass between pets and humans, the organization said on its website. So people, let's not panic. Let's just say our prayers and that God will protect us all, including our fur babies. We love them so much. So don't panic. Don't worry. It's going to be okay. All right? Just take care of yourself. And like they said, maybe shoes for your dog so that when they're out there walking around, then you bring them back in. You can just wash the little shoes or wash their feet when you come home. So it's kind of hard sometimes if your dog sits on the ground that you would bring it in and bathe it every time it did that. But, we'll do what we have to do to protect them and to care for them, just like we do our children and our friends and our family and all of our loved ones. And you guys are like my loved ones. I care very deeply for you, and I'm praying for all of us. And thank you for tuning in.